Dr. Tanvi, and I want to ask you, are you putting your eye drops correctly? The reason why I'm asking this question is one day a patient came to me and he wasn't getting better, and I kept asking him, are you putting your drops correctly? And he said, yes madam, I have been putting it 6 times a day. I said, oh, but that's a long time, and why aren't you getting better? So then he had got his drops with him. I said, can you just show me how you're putting the drops? He said, of course, why not? So he opened it and that's how he put it. And I got the shock of my life. I said, you've come to an eye doctor, you've had an eye problem, I have prescribed you eye drops to be put into the eye. So here I am, and I want to tell you exactly how you have to put the drop, because that's what's making you better. So when you want to put an eye drop, you ask the patient to sit comfortably. He does not have to always lie down. You ask the patient to tilt his chin up. Always make sure your hands are clean so that when you open the cap of the drop, it's not dirty. You're not touching this part, because that's what is very close to the eye and can get infected. So either you can keep this down or hold it. Ask your patient to look up. Just pull the lower lid. That's it. You're not required to pull both eyelids. You don't need to pull out the lower lid. See, there's a space created there. So I ask them to look up, pull the lower lid down, put one drop and look down Halibar, and then close your eyes and do a bandha step. So with this, you will not get any drop falling outside. It will stay in the eye, and maybe the patient can open the eye in 1 minute, count till 30 seconds even is good enough.